Right. Greetings. Welcome to Cadaver Confessions. I'm Dr. Som Sharma. Today we're going to be focusing on another heavy metal for a poisoning, and it has been tentatively titled as the silver bullet. However, you have to be aware of the fact that this is not exactly silver that we're going to be focusing on today. Instead, what we're going to be focusing on is going to be another heavy metal that has a silverish hue to it, and that particular metal is effectively going to be mercury. Today we're going to be starting the lecture with a small story anecdote. This is a clinical story. What you have here is that you have an individual who's a young boy, and he comes to a doctor, a female doctor, who examines this particular child, and the chief complaints that he's been brought with are breathlessness, tremors, and mouth ulcers, which are prolonged and not healing. Now, obviously, this gives up a lot of differential diagnosis among us as MBBS professionals. Breathlessness and tremors do have a lot of diagnosis that can range from, say, asthmatic illnesses to allergic rhinitis. But she evaluates this particular individual, Ramu, and what we later on found is that on examination, this person is also displaying memory loss. He's having some neuropsychiatric manifestations such as depression and irritability. And she then goes ahead and takes occupational history, exposure history, and finds that this individual is possibly suffering from subacute mercury poisoning, which can be due to either inhalational or dermal exposure or possibly both. She investigates the case further, and what she finds is that Ramu is actually an individual who's been working in a factory that deals with mercury and has not been given any protective measures. This has caused the manifestations of both subacute as well as chronic mercury poisoning, which is what we're going to be focusing on today. Excuse me. Mercury is always going to be treated with another type of therapy called as chelation therapy. We were exposed to it during our class on arsenic. Our doctor has initiated chelation therapy on Ramu, and he has successfully recovered. Now, what exactly is mercury? Mercury is also given another synonym, also called as quicksilver. Now, quicksilver, basically, it is elemental mercury, is a liquid metal. It is bright, it is silvery in color, and it is volatile at room temperature. In Hindi, we also call it as para. Now, mercury is actually a very common compound. It is used in variety of industrial uses, and it also has its role in the thermometers or the analog thermometers. The poisonous compounds are basically mercury chloride and mercuric nitride. These are by far the most commonest, and they are the ones which are the most poisonous. Elemental mercury is not going to be causing any problems. In its purest form, just like arsenic, it is not going to cause any specific damage. But in its compounds that are chloride or nitride based, this is where the largest potential for poisoning occurs in an individual. Metallic mercury, as I said, is not poisonous, and if swallowed, it is not going to be absorbed, it is going to be excreted as such. But mercuric salts actually are the ones that are going to be poisonous, and these salts come in various forms. They can be either in sulfides, nitrides, chlorides. They're also coming in various compounds of daily use such as cinnabar and sindoor. Sindoor is something that is again very common in the Hindu females. The fatal dose is relatively small. It takes a very small quantity, that is 1 to 2 gram of mercury chloride, to actually be fatal. So it's not something that requires a large amount. It's very small amount, 1 to 2 grams, basically about 2 or 3 chutkis that we call it. And the fatal period ranges from 3 to 5 days. So it has a long sort of a fatal period. It is not an immediately effective poison. The mechanism of action for mercury is very similar to what we find in arsenic and lead. Here also they are binding specifically with the sulfhydryl group. The sulfhydryl group, if you remember, is something that is a group that is associated as ligand activity. It is associated with enzyme activity. Though here what mercury does is it's going to bind with the SH group, and it is going to affect three major areas. Going to affect the proteins of the cell, it is going to affect the nucleic acids, and it is going to affect the cell division or the mitotic apparatus, and it interferes with enzymes that are responsible for energy production for mitosis, and it also reduces cellular transport. This particular transport is reduced, which again leads to the manifestations. If you contrast this with arsenic, arsenic effectively is a poison that is going to affect predominantly the ATP production, but here we have multiple areas which are affected. It is basically divided into multiple stages, and mercury in the first stage basically is going to cause, on oral ingestion, it is going to cause a very metallic sort of a burning taste. This particular burning taste will also be accompanied with constriction inside the throat, and the voice or the laryngeal apparatus is going to be affected. There is going to be some difficulty in breathing, that is, there is going to be some breathlessness, but in the initial stages it is not very concerning. Individual might feel like I'm just getting a bout of allergy. There is a burning pain in the mouth because of its local irritant effect. This is actually an acrid irritant metal, and it can cause circulatory collapse if the amount is given via inhalational route and it's quite large. The mouth and tongue may be corroded, and a very typical feature, this is an MCQ for you guys. If you guys are listening, always focus. If you get some sort of a poisoning with a grayish white coating in the mouth or the tongue, chances are it is going to be mercury poisoning. Now, what happens here is mercury in its salts goes and it corrodes the overlying layer of the mucous membranes, and this produces this particular coating. This is where the salts which have acted upon the mucocutaneous junction are now creating this sort of a coating. Very important MCQ. There is going to be, of course, hot burning pain in the mouth. This is on exposure specifically to nitrites and extending down to the stomach and abdomen, followed by nausea, retching, and vomiting. This is all due to the irritant effect. Mercury, as it enters inside, it irritates the entire intestinal system, and because it is mucous membrane right there, it is going to be easily irritated, very easily damaged and exposed. The vomitus is going to again contain greyish slimy mucoid material. The mucoid material comes because there is a lot of mucosa here, there is a lot of stuff inside the stomach which is mucoid in nature, and greyish white is again going to be because mercury, when it comes in contact with anything that is biological, is going to create a greyish white discoloration due to its local irritant effect. This is followed by, very important, diarrhea with blood stained stool and tenesmus. You have to remember that arsenic also causes diarrhea, but there, if you remember, it is rice water stools, very similar to cholera. Here you have bloody diarrhea and tenesmus. Tenesmus basically means crampy, painful feeling in the abdomen, very crampy abdominal pain this causes. This is also an MCQ. So if you've been asked heavy metal which causes diarrhea, so yes, you have all three, lead, mercury, and arsenic. But if it is bloody diarrhea and tenesmus, this is typical manifestation for mercury poisoning. Inhalationally, now all of this was orally, but if you're taking it inhalationally, there's going to be symptoms such as ataxia, restriction of the visual field, paresis, and delirium. This is due to the neurological manifestations of mercury, which we're really going to be focusing on later. All of this again is very similar in activity to other poisons also, such as methanol, but you have to remember that this is just going to be one part, which is also going to be accompanied with burning pain in the stomach and mucoid discharge and bloody diarrhea. In the second stage, that is basically coming after 24 to 48 hours, you actually find glossitis and ulcerative gingivitis that is going to be appearing. This again is due to the long-term effect of mercury on the mucous membranes, causing ulcerations which are not going to be healing, they are going to be progressively increasing in size, and this again is going to be accompanied with a greyish white discoloration. There is going to be severe infection, there is loosening of the teeth, and necrosis of the jaw may occur. This is again a very important MCQ for you to note. Phosphorus in itself may also cause a symptom called as phossy jaw. As we see phosphorus in the coming lectures, we'll find that phossy jaw is one of the typical features of phosphorus poisoning. But here, what actually is happening is necrosis. It is localized irritation that is going through the jaw and the tongue and the mucus, and then it's going down and deeper into the bone, causing this particular condition. And in 2 to 3 days, in the stage 1 is basically 0 to 1 days, and stage 2 is 2 to 3 days. Acute renal failure is going to develop with uremia. This is again due to the metabolic products of mercury that are causing damage to the kidneys and not coming out of the system. The recovery may take 10 to 14 days, even if you have given adequate chelation therapy. The acute renal failure to be completely resolved is going to take about 2 weeks. There's going to be membranous colitis, which along with dysentery and ulceration, and there's going to be loss of blood. This is one of the reasons why circulatory collapse is happening. The entire colon, the soft membranous mucocutaneous area of the colon is going to be damaged, and this causes a lot of ulcerations throughout the colon, a lot of bleeding along the entire GIT and lower GIT. The treatment basically is many-fold. It is not a single treatment protocol. Emetics and gastric lavage with warm water and magnesium carbonate are basically advocated. Why? Because they tend to remove the unabsorbed mercury from the GI tract and reduce further damage to the gastrointestinal system. This is our basic objective. Why we are giving warm water is because it relaxes the smooth tissue and it's easier for the gastric lavage content to be extracted out, and magnesium carbonate because this is effectively going to bind with the mercury that is not absorbed and is going to come out in a neutral form. Albumin in the form of egg white albuminate of mercury is basically formed if we give any sort of a albumin based demulcent. So that is absolutely contraindicated. This is another MCQ for you. Why albumin based compounds are not given, or why egg white is not given, is because you can form a albuminate with the mercury, and this compound is going to be further absorbed in the stomach and can lead to other parts of the systemic circulation. Now this is very, very important. If you are not able to do your gastric lavage properly, this can be a big problem later on. Demulcent drinks are used to prevent damage to the stomach mucosa. These are drinks such as magnesium based drinks. They tend to coat the mucous membranes of the stomach. They do tend to inhibit any ulcerative damage. Activated charcoal is having a great power to absorb it and should be given, because what happens is mercury is going to adsorb, adsorb over it. And British anti-Lewisite is the antidote. This is something that has to be remembered by you. British anti-Lewisite is a key antidote here. It is given deep intramuscularly. The initial dose is 3 to 4 milligram per kg, given every 4 hours for a period of 2 days or 48 hours. And if there is improvement, you can continue the same dose for 6 hours and then thereby reduce it to twice a day. But in severe cases, in cases where we are not able to see any improvement even on the first dose, we tend to give 250 milligram every 6 hours for a period of 10 days. If you can see the difference here, 3 to 4 milligram every 4 hours, whereas 250 milligram every 6 hours. This is very important to note. In severe cases, especially the cases in which there is circulatory collapse, or if the individual is not showing any signs of improvement after the first dose, then we have to go for 250 milligram dosages, which has to be extended for up to 10 days. This is how much time it takes for the excretion to actually occur. The specific management, this is a very old or a historical method. This is no longer used, but sometimes may be asked in MCQs. It's an old and historical or traditional method that was initially used. They used to make a sulfoxylate based compound, and this was a freshly prepared solution. And this used to be given orally, and it used to be left in the stomach. If the patient is unconscious, then we do it through a feeding tube, and it used to be there inside. The mercury used to bind with it, make a non-soluble compound which used to be excreted out through the bowels. But this is effectively only useful in the first 30 minutes. That is how much time it can stay inside the stomach without it actually being absorbed. This is historical. This is not something that is very, very commonly done nowadays. But yes, it does have a lot of historical significance. You can produce diuresis. You can ask the kidneys to effectively work for a very long time. You can use those renal output methods, but if you're using 5 to 10% glucose in normal saline, this can produce diuresis, increase the renal excretion, but you have to note that mercury actually is a nephrotoxic compound. So it's a compound that damages the kidneys quite a lot. So if you are using any diuresis producing compound, very important, if you're using any diuresis based elimination method, you have to monitor the renal function. It has to be done very regularly. You have to do it at 6 to 8 hourly just to evaluate whether the mercury is not damaging the kidneys further. Chronic mercury poisoning, something that is far more commonly encountered among individuals who are in an industrial setting or have an exposure based on their occupation to mercury. Mercury in chronic poisoning occurs due to the vapors or the dust. Now, it can be any other salt of mercury or a compound of mercury is being used. They use it in batteries, they use it in variety of industrial compounds. So, here is where if adequate mask protection and dermal protection is not done, individuals get exposed to it, and that is when you start seeing the manifestation. There are certain manifestations that are very typical. We will be looking at that also. Now, mercury compounds, not right now, not in today's time, but there was a time when mercury compounds were used as medicines internally. One of the key areas where mercury compounds were commonly used was actually in syphilis. So, one of the treatment modalities for individuals with syphilitic ulcers was to inject mercury based compounds into their genitals, that is, the urethral regions, for treatment. Of course, it was considered standard practice at that time, no longer. But yes, that is one of the reasons why a person can get chronic mercury poisoning. But this is more historical than actual. Right now, symptoms appear when the exposure, either dermal, inhalational, or ingestional, is when the mercury level in the blood exceeds 100 microgram per deciliter. This is when the actual symptoms start appearing. Because this particular value is important because the excretion is going to be less than 0.3 milligram per liter in urine. So if you even find in urine analysis or toxicological analysis a level that is around 0.3 milligram or little higher than 0.3 milligram per liter in urine, you can diagnose that person as having chronic mercury poisoning. Chronic exposure comes by another name, it is known as hydragyrism. Hydragyrism because the mercury in itself has a hydragyri as the name. Hydragyrism is the term which is applied for it. Now, chronic exposure to elemental mercury basically is going to give you a very classical triad or a trishul, as the trident that I call it. Is a classical trident or trishul of mercury poisoning, and that is it's going to give you stomatitis, that is the oral cavity is going to have inflammations, there's going to be tremors, and there are going to be neuropsychiatric changes. If you remember the case ahead, this individual Ramu, he had tremors, he had anxiety and depression, and he had mouth ulcers. So stomatitis with neuropsychiatric manifestations such as anxiety, depression, or mood changes, and lastly you are going to have some or the other type of mouth ulcerations. There are typical manifestations, neuro manifestations for chronic mercury poisoning. One of the first one is going to be something called as a Danbury tremor. This Danbury tremor occurs first in the hands and thereafter it is going to progress to the lips and the tongue and finally involve the entire arms and legs. So yes, it's first seen in the hands, that is, this is where it is first seen. Thereafter the progression is going to be in the lips and the tongue. So individual first is going to have intentional tremors. Thereafter, he is going to have difficulty in speaking. The tongue is going to be in state of tremor. Lastly, it is going to involve the entire arms and the legs. And this particular progression is called as a Danbury tremor. This tremor is moderately coarse and is jerky. So it is not going to be similar to what we find in Parkinson's disease, but it's actually going to be like this. This is how the manifestation occurs for a Danbury tremor in case of mercury chronic. Now, in mercury, you have another type of manifestation which is called as Hatter's shake or glass blower shake. Now, this particular type of neurological manifestation occurs because these are exposed to individuals who are working either in the hat industry or a glass blowing industry. It was mostly inhalational, of course. The condition is called as Hatter's shake or glass blower shake because these individuals again used to have those jerky tremors similar to Danbury tremors, but this tremor was specifically seen in individuals working in these two professions. Now, this particular condition was one of the first conditions that led to mercury being diagnosed as a causative element for these types of neurological manifestations. You have another type of condition, again neurological in nature, which is called as concussio mercurialis. This is different from both glassblower shakes as well as Danbury tremors in the fact the individual will be unable to perform the basic tasks associated with life. So even things such as wearing a shirt is going to be impossible. This is similar to what we find in an individual who is suffering from a concussion. He is going to be disoriented. The tremors are not going to be so evident, but the individual is going to be so disoriented. Even simple tasks such as putting the button is going to be a big deal. This individual later on may find it difficult to even walk properly and has a staggering or a drunken sort of a gait about it. This is known as concussio mercurialis. You have mercurial erethism. This has been asked 2-3 times in MCQs. This is seen in persons working with mercury, especially in mirror making industries. Now, this term is referred to the psychological effects. Erethism is referring to the psychological effects. These are not physical manifestations, but they include anxiety, depression, mood changes, increase in irritability, loss of confidence. These individuals do not have an explained criteria for this. It's an onset that is gradual in nature, and this is seen due to dermal exposure. So here there may not be a pre-existing element of tremors, but there may be these sort of changes that are occurring more common. Mental depression, delusions, hallucinations, and suicidal thoughts. These are one of the key features for mercurial erethism, and emotional instability, loss of memory, as well as insomnia may be seen in individuals who are chronically exposed to it for a long time. So the initial manifestations include unexplained anxiety and depression, loss of memory, and insomnia come later on, and these indicate that the exposure has been going for a very, very long time. The progression in chronic cases generally follows this particular pattern. Now, this is not something that is very sure shot, but it is commonly seen. You first get Danbury tremors, that is jerky movements in the hands that are going to the lips and the mouth, and thereafter involving the entire arms and legs. Further progression to Hatter shake, which is the generalized shaking of the entire body. Then you have concussio mercurialis, inability to actually go ahead and perform simple tasks because of both the tremors as well as the neurological instability. And lastly, neuropsychiatric manifestations that include suicidal ideations, hallucinations, and delusions. This particular condition called as mercurial lentis is affecting the anterior chamber of the eye, and here there is going to be a very peculiar eye change in which there is a brownish deposit of mercury throughout the cornea and the anterior lens capsule. Here the color of the eyes is typically seen as being brownish in color. This particular brown color is indicative that the individual has been exposed to chronic mercury poisoning. It is generally bilateral, it is not going to be unilateral in nature, and it has no specific effect on the visual acuity apart from the fact that the individual may complain that I do have some sort of a difficulty in when I look at my eyes in the mirror. Very, very common condition, very frequently asked in both short answer questions and long answer questions. Very important topic here is called as the Minamata disease. Now, this particular disease is named on a geographical location which is called as Minamata Bay up in Japan. Now, this particular bay was lined by industries that had a lot of pollutants or effluents which were being dumped into the water of the bay, of the sea. There, a lot of mercury was deposited. This mercury was consumed by the fish. It stayed in the fish because it is a cumulative poison. It stayed inside the fishes. The fishes were eaten or consumed by the individuals who were living along the bay. And these are the manifestations that came. It actually occurred in small children. It had been due to consuming the fish which was poisoned by mercury, and it was labeled as a disaster very recently in 1956, and the reason was identified as being eating this particular fish that had mercury The manifestations were neurological, developmental. They were very, very specific, and they were most commonly found in children. Then you have another cutaneous manifestation that includes something called as acrodyna or pink disease. If you look at the legs, it has a generalized body rash sort of a disease. It is due to a hypersensitivity reaction due to presence of mercury, which is of course a foreign body. It is not one of the elements that is required in the body. So it is a foreign body and causes a hypersensitivity reaction. You have to differentiate it from the raindrop pigmentation that we see in arsenic. In arsenic, the raindrop pigmentation is different. It is whitish patches over darkened skin. Here, there is going to be generalized redness all over the body part. In terms of medico-legal importance, it's commonly accidental and sometimes it is homicidal, suicidal is very rare. Very rare. 90% of the times, mercury poisoning is going to be accidental in nature, is going to be due to occupational exposure. It is very rare that somebody is going to use mercury for committing suicide. This particular poison takes 3 to 5 days to kill. It is treatable pretty easily, so it's not something that, and it has a very burning and acrid taste. So ingestion is going to be a big problem. Metallic mercury actually is non-toxic and is not absorbed. The hazards, even there's a thought process. There's this thing that has been perpetrated by certain movies. That you take a thermometer, you break it, you take mercury, you put it inside some food stuff, person drinks it and dies. No, it won't happen. The glass part of the thermometer is going to be more dangerous than the mercury wala part. The vapors actually are poisonous. These mercury vapors are the one that are going to cause a problem inhalationally, and accidents occur due to inhalation of it. It is corrosive, it is irritant, it is going to cause damage to the microvasculature as well as the alveoli of the lungs. The treatment modality is removing the person from the exposure, giving lots of bronchodilators and giving oxygen therapy, and waiting for self-healing of the lungs, or in certain cases, O2 therapy may be required lifelong. Elemental mercury is highly lipid soluble. It is a cumulative toxin. It is going to go and it's going to get absorbed into the fat, and it can be absorbed from the skin. It can also go and it can store itself in the myelin sheath. It can damage the nerves. When it is rubbed on the skin as ointment, it is readily absorbed and can cause poisoning. So there was a time when mercury was a very stable component for any sort of a dermatological illness. Not so much nowadays, but yes, it was some used as a treatment modality. Mercury chloride is effectively used as a disinfectant, antiseptic, and a histological fixative. This is not used in treatment modalities. It is used for fixing or disinfecting areas, locations such as OT beds, sites such as floors, those areas. Accidental poisoning is very common because there might be a solution of mercury chloride which is being used as a disinfectant. Person may consume it, especially children. There were use of mercury-based solutions as a abortifacient. No longer done right now. Quacks may use it, but we don't. Mercury can cross the placental barrier. It can cause poisoning in the fetus, and this is more pronounced if you remember the Minamata Bay disease. In Minamata, the predominant manifestations were seen in children who were in the womb. It is not a constituent of human body, as I said before. It is not a metal which is required. So, if you find it in the blood samples, definitely it indicates poisoning. Do revert back if you have any queries, comments, or suggestions. Do tell me how you want to increase the effectiveness of these particular lectures. Till next time, Cadbury Confessions logging out. Dr. Som Sharma here. Bye.